Good evening, everyone. My name is John Erickson. I have the esteemed privilege to be a council member here in the city of West Hollywood. I want to welcome you to tonight's event. I also want to welcome you on behalf of myself and my colleagues, Mayor Pro Tem Meister, who's in the virtual waiting room. I see you, as well as on behalf of our other council members, Seppi Shine and Councilmember John D'Amico. We're so glad so many of you who are joining right now could register and be here for this really important panel. We've gotten an overwhelming number of questions, as well as we have such an amazing group of panelists I'm so excited to listen to. And we want to get right into it. So without further ado, I want to turn it over to tonight's moderator, our esteemed Mayor, Lindsay P. Horvath. The show's all yours.
Thank you so much, Councilmember Erickson, and welcome everyone to tonight's panel discussion about the COVID-19 vaccine. We have received countless questions, inquiries, fears, concerns, frustrations, you name it, about this vaccine. And so I thought it would be a great way to have the conversation, bring everybody together. We also had community members volunteer to share their experience of participating in vaccine trials. So we're going to try and hit all kinds of questions here tonight and make sure that we keep it conversational, try to keep it accessible, and help you get questions answered and hopefully help you feel better about getting the vaccine, because we're living in such an uncertain time. There are so many fears, so many uncertainties, and hopefully this does just a little bit to alleviate some of those fears and let you know that everyone's working hard to keep you safe and get us through this really difficult and challenging time. So tonight we have, as I mentioned, participants in some vaccine trials who will share their experience. We have experts from Cedars-Sinai Medical Center who themselves have been vaccinated and also are, have worked with COVID-19 patients. And we also have Dr. Simon here from LA County Department of Public Health to speak to the vaccination distribution process and answer questions about how that's going and how people can access their vaccines and what we should expect from that process going forward. So I'm gonna start first with three of our panelists who bravely and boldly signed up to participate in vaccine trials. Thank you, first of all, each of you for doing that. We know that without people signing up to do that, we wouldn't have the information that we need to make sure that the vaccine is safe and to learn all the things that we need to learn through that process. So Mandy, I'm gonna start with you. Amanda Laughlin is also a commissioner in the city, but a resident of West Hollywood, and first came to me with this idea of sharing her experience. And so I'm gonna start with you. If you could tell us a little bit about your experience in your COVID vaccine trial.
Sure. Thank you, Mayor Horvath, for the introduction. My name is Mandy Laughlin. I work in a job with the public. So I thought back in October, when I got the chance to get the vaccine, that it would be a good idea for me, because at the time, that's before anything got approved. And we weren't really sure what was happening, you know, what the end game was for the vaccine or for COVID. And so for me, I thought the best way for me to protect people around me and also protect customers and protect my coworkers, as well as myself, was to get involved in the vaccine. So I have a friend who's a doctor, and he was referring his friends, his family, everyone on Facebook, hey, these are the trials that are going on, giving us all the information. And so I jumped on one. I did the Pfizer trial at a place called Anaheim Clinical Trials, which was really nice. It was a really professional site. They were able to move us all in and out. I got in front of a doctor who answered all of my questions, and I had a ton of questions, and they did a really thorough screening process. I got my first dose in October. After my first dose, I could actually, when I went in, I felt it burn down my arm, which was new for me because usually I get a shot and then nothing happens, but I felt like a burning go down my arm, and then my arm was sore for the whole day, and I got a bump at the injection site, like a definite noticeable bump. And then I went home and slept for the whole day. And the next day I was fine. I got a little bit of an elevated temperature, but only up to 99. And I took a Tylenol, went away. And then the second dose I got in November was about the same reaction, except on day 2, I woke up and I felt just like I'd been hit by a truck. I was really tired. I felt like I had a seriously bad flu. Same reactions, only the fever got a little bit more elevated and I felt a little nauseated. But I was able to just sleep and take care of myself as I would if I had the flu, and then I felt better. But all in all, for me, any side effect from a vaccine, any like reaction from a vaccine, from any vaccine is better than getting the actual thing that you're being vaccinated against. And the peace of mind is huge, because once you get that, you can't change your behaviors, and you need to still wear your masks. You need to social distance. You still have to, watch what you're doing around a vulnerable population. But for me, the peace of mind was huge. I think after the second vaccine, I waited 2 weeks and I went and got an antibody test independently to see if I had the vaccine. I knew since I had so many reactions, I probably did, but I went and got a $25 vaccine test at the pharmacy at Ralph's, and it showed that I had the antibodies, and that was enough for me. And then about 2 weeks ago, Pfizer unblinded me and confirmed that I did in fact get the real dose. And it was actually the doctor that put me in the group. It was really helpful referred me to the group was really helpful because he started an actual vaccine Facebook group. So all of us that were participants, there's about 100 of us in LA County that are participants, would go in and share our information and like our experiences and about the clinics and the vaccine and which one we got and the doses and everything. And so it was a really helpful way to go about it and sort of maneuver around that and see how you compare to other people. But yeah, all in all, I'd do it again. I'm really glad about my decision, and I'm really glad that I was able to also encourage friends to do it. So for me, it was the right choice. And now we have, 2 vaccines and maybe a third that's going to be approved. And I feel that it's a step in the right direction for all of us.
Thank you very much. Carrie Ann, I know you had a very unique experience and also desire to participate for a very specific reason. So if you could tell us a little bit about your experience.
Sure. Thank you, Lindsay, for inviting me, Mayor Horvath for inviting me. I am, my family and I have been isolating for the most part since, March, like most people, and, have been pretty conservative, although we have had to travel a couple of times for family matters. And, in the fall and into the winter, the conditions everywhere were such that, I was very, very, very reticent to consider taking the vaccine, any kind of vaccine. And I don't know what happened, but there was a point at which I started to get concerned. I would say maybe around the holidays, around Christmas or so, when I started, as I was reading about the vaccines that were being developed and the efforts to get people to participate in trials, I started to actually get concerned about, the potential inequities that were going to exist, going to result because of the trials and because of the, and how the vaccine was going to get distributed. And there was just so much noise out there about it. And so I really started doing some research about how the vaccines were being tested and, who was being selected to get tested and what, kind of information was available to educate the public about it. And, particularly in my family, as a Black woman and as an active member in, my community, I was having conversations with friends and family. And, at first it was kind of jokingly like, there's no way I'm getting that vaccine. Who knows what's in it? But then as more information started coming out, I started to get concerned that, we would be the last ones to get vaccinated. And then as, vaccines were starting to, as they were starting to develop systems for, scheduling people to get vaccines, I started worrying that, what if, everyone starts getting vaccinated, but, Black and brown and underrepresented communities, and the society just opens up. And then those are going to be the communities who are going to still be at risk of not getting vaccinated, of getting sick and being out of work and losing school. And they're not going to close the, society back up, and they're not going to have funds available for people like that. And so around that time, I also saw an ad on Facebook. So sometimes Facebook can be used for good. I saw an ad on Facebook that UCLA Lundquist Institute was looking for participants for the phase 3 of the AstraZeneca trial. And so I reached out and I applied, and they called me in. And the way that they screened me and explained it to me was that in the phase 3 trial, they were really looking for people of color who were, still being somewhat isolated, but were had potential opportunities to be exposed to the virus, because they wanted to see what would happen, how sick they would get. And, they were testing out the efficacy of the virus and whether or not it would prevent folks from getting, so sick that they would be hospitalized and, what have you, if they contracted COVID. And so I talked to my family. I have some friends who are public health experts and doctors in public health and around the country, and so different parts of the country, and talked about the different vaccines that were available. And I decided to go ahead and go for it. And so I got my first jab in January, and it was a double-blind trial, meaning that neither I nor the research doctor, knew whether or not I was getting the vaccine or whether I was getting the placebo. And 2 out of 3 participants were selected for the vaccine, and the third was getting the placebo, but it was, blind. So when I got the first vaccine in January, I went to, it was down at Harbor, UCLA, and, they were very professional, and the Lundquist Institute does lots of research and trials around lots of different drugs and vaccines and things like that. So it's a really smooth operation down there, and they're very, very, supportive and welcoming, things like that. So it made me very comfortable, gave me, explained everything to me very extensively, gave me several opportunities to think about it, if I wanted to make sure I was really sure that I wanted to participate in it. And after getting all the information and answering all of my questions and things like that, I decided to go through with it. So I got my first jab, and I didn't really feel anything. Then the next day, my arm was a little bit sore, but it's a pretty big needle. So I didn't get too excited because, I had gotten, stabbed with a needle. So I just kind of went about my business. And then I got my second dose, my second jab 2 weeks ago, about almost 2 weeks ago now. And when I got the second one, I experienced some tenderness in my arm again, but less than I had the first time. So I wasn't as confident that, about what I had gotten. And it wasn't until then that I heard the cheat of going to get the antibody test. And just when I was thinking about getting the antibody test, someone sent me a link to sign up to get a vaccine, and I was able to get scheduled to get one of the Pfizer Moderna vaccines. And so I called up the trial and I told them that I had gotten an opportunity to get vaccinated. And they told me that if I got an opportunity to get vaccinated, to call them, and then I would get unblinded. And so I told them my appointment, and within about 45 minutes, they called me back to tell me that I had received the vaccine, and that, then we talked about what it would mean for me to be double vaccinated, because the AstraZeneca vaccine is a different kind of vaccine than the Pfizer and Moderna vaccine. And the efficacy is a little bit lower than the Pfizer and Moderna, but still very high. It's about 70% effective against contracting the coronavirus, as opposed to the Pfizer Modernas, which are both, I think, over 90%. And so they told me to think about it, and it didn't have anything to do with my still participating in the trial. I'm still a member of the trial, And so I talked again with my family and some of my, my trusted advisors, and I actually decided not to get the Pfizer Moderna vaccine because I figured that, I have a 70% chance. I'm 70% protected against it, which is better than other vaccines and protections. And so many people need to get a vaccine that, if I needed to get another one later, I always could. But right now, I think it's important for as many people to get it as possible. The other part about this is that I was very public about having made the decision to get the vaccine. So I went through doing like very public posts on social media to my community to let them know about my process of deciding to get vaccinated and inviting people to ask me questions and things like that, because I knew that there were people in my family and in my communities who are very, suspicious and reticent, about not just vaccines, but just about their relationships with, the medical community in general. We know about, tests and trials and, ways in which, Black and brown people have been, manipulated and discriminated against in the medical communities. And so I thought it was really important for, people who trusted me and found me to be credible to hear what my experience was with it. And I'm glad to say that I have had some really great conversations with people. Some of them have changed their minds and decided that they were going to get vaccinated. Some people have, they're not there yet, but this is a process. And I'm just glad that I can be helpful in, spreading information, truthful, accurate information, credible information, or at least inspiring people to go out and seek it out. So.
Thank you so much for being with us tonight, Kirian. I know you as president of California NWPC, but I know you wear many hats, and we thank you for wearing this one and participating in this trial and sharing your information. Austin, tell us a little bit about your experience. I believe we heard from Mandy about Pfizer, AstraZeneca from Kirian, and you had your trial with?
Johnson & Johnson. Thank you, Mayor Horvath and the City of West Hollywood, as well as our incredible panel of medical experts for being a part of this and helping to spread the word and address concerns and questions and everything that's going on with this ever-changing, so quick moment of time that we're in. And I preface it with that wild moment in time because the way we were feeling as a society, the way at least I was feeling personally back in September, October, when I started to see these trials come about, was a whole lot different than I see the temperature of society at large right now. And I'm really, really grateful for that. I did participate in the Johnson & Johnson trial in November. I signed up in October. In November, I went in and got my one and only shot. The Johnson & Johnson vaccine is just a one-shot dose. It's a 2-year study that they asked me to be a part of. It's a maybe on the unblinding. I had gotten connected to this group through, as Amanda said, another, she alluded to another online group that formed. People communicating about the vaccines, about COVID, about reluctancy and eagerness towards those vaccines. And Dr. Josh Albrechtsen is a friend who has been a faithful compass communicating about COVID since a year ago, February 2020. And when he began speaking about the stage 3 trials going on, whether it be Pfizer or Johnson & Johnson in my case, it really just got everybody thinking, as it did. And, I grew up getting vaccines. I grew up being very vaccine friendly in my household. My mom, right there, before kindergarten and all that stuff. And it wasn't a question for us. But I noticed so many folks having hesitancy and fear of this vaccine. And a lot of it was attributed to, Operation Warp Speed, the quickness that this was being deployed and the concern that caused for folks. So when I had seen folks just across the board beginning to pause about signing up for this vaccine, I went ahead and did a little bit of research into it and the steps and the processes, and regardless of who sits in the White House, how the FDA goes about approving these vaccines. And when I got just a little bit of familiarity with that and had enough confidence to know that the process is still thoroughly intact, I had fears myself. I like to rock climb. And one of the things we say in rock climbing is trust your climbing or trust your equipment. And if you trust the science and you trust the process, it's okay to still be afraid. You can move through it though. And so I wanted to do that. And I wanted to, one, get enough, be one of the participants to help this vaccine get out to the general public as quick as possible. I also wanted to be able to communicate about my experience with it, to which I don't know if I got the real thing or the placebo. I think I got the real thing. I had numbness in my arm. I had back pain the next day. I had waves of chills and exhaustion. It didn't last more than 24 hours. But then again, this was November in 2020. We're in the middle of an ongoing pandemic and it's cold outside. So the reaction could have came from a lot of things. I haven't been unblinded from that one yet, though. It's still a maybe. We'll see once the Johnson & Johnson dose gets approved, which it's looking more and more likely that it will. We'll see what happens then. But the process was at Anaheim Clinic, as Amanda's was as well. It was a fantastic facility. And I know they're actually still taking on some participants as well. I'm happy to share that information with anybody if they're interested in seeing if they can be a participant in that trial still.
Thank you so much. And quickly for each of you, did you have a sense of what was going on outside of your participation in the trial, or was it really your experience that you got a sense of? Do you know anybody else who was in the trial with you? Or, was it diverse? Was it, what kind of thing? Do you have a sense of what kinds of things they were learning from the trials you participated in?
I mean, I did because of the Facebook group, and it's actually the same doctor. It's Josh that actually referred to me, Austin as well. It's the same doctor. But because of his group, I did get a really good sense of what other people were experiencing. And at the clinic, everybody was pretty transparent, and they were conducting more than Pfizer at the Pfizer and Johnson & Johnson. They do a ton of clinical trials, I think, and you could listen to everyone's chatter because everyone's all of the staff. There must have been at least like 30 people on staff the day I was there, and they were all talking about what was going on, and they were all pretty transparent. And when you would ask questions about, so are other people going and getting an antibody test in between shots? Like, what are they learning? What are they saying? Like, what are you guys thinking? And then when I would call in, like if I had any other illnesses, I would call in and report it so they could log it in the trial, and we would go through things like that. And I would ask if anyone else had any similar illnesses pop up, and no, they didn't. That's just what's going on with you. But I mean, I was able to glean a lot of information from a lot of different people during this experience.
I have not interacted with anyone else, and when I've gone down to get my 2 shots, there are other people there, but you don't know what they're there for because they run so many different trials. I don't know how successful they have been in trying to diversify their population, that's in this phase of the trial. I know that was the goal and the intention. And I did try to recruit a couple of other people to participate, and it just didn't work out, the timing of it. I actually got in, I think it was like the last week that they were conducting the trial, or that the phase, they were recruiting people to participate in the trial. I think there are 30,000 people who are participating in this trial here in LA, but my understanding is that they're doing this all over the country, so in different locations in the country in groups of 30,000 people, and the same 2 out of 3 people. And it's also a 2-year trial. So every week I have to check in on this app, to report whether I'm experiencing any kind of symptoms or, anything like that. And then if I am, then I come in and I get a COVID test, and, they'll try to help me to figure out, what's going on or whatever, whether it's related to COVID or whether it's, unrelated.
In terms of my connection with other group members, when you're in elementary school and they tell you that if you have a question, someone else in the group probably has that same question. Being a part of the vaccine group, the trial vaccine group online, I saw so much of that. These questions that would come out that some people might be a little embarrassed. Maybe I was embarrassed to ask, but there it is. And then there's a bunch of responses, and medical experts were able to chime in and really help drive it down to a granular level, and so that anybody who was curious was able to understand it. And this ended up just giving me a lot more confidence as we saw new strains starting to come in, mutations develop, and really what this meant in terms of the vaccine's potency, what we should be concerned about, what maybe is generating some clicks, and then what's some things we should actually really be paying attention to. So being a part of this community and looking at it square on and talking and sorting through the fears and concerns has been an invaluable experience. And I'm very, very grateful for everybody who's been a part of that and kept this dialogue going.
Well, thank you all for your participation in these trials and for setting the tone for this panel, because we have amazing medical experts here with us. And I know when I log into a panel with medical experts, I'm like, go into this intimidation mode, like, am I going to understand what they're saying? You know, am I going to get it? And, you know, so I really appreciate you sharing in your own words sort of what your experience has been. To provide context to your experience, we do have experts from Cedars-Sinai here with us tonight. And first, I'd like to introduce Dr. Richard Riggs, who is Senior Vice President of Medical Affairs and Chief Medical Officer at Cedars-Sinai Medical Center. Dr. Riggs provided a webinar for elected officials and other community leaders that I found incredibly helpful. And so I'm going to start with you, Dr. Riggs, if you can kind of set the stage for us and give us some context for what we've heard from our participants' experience. What should we know about the vaccine?
Well, by the way, thank you, all three of you, for sharing your stories, as different as they are, but they're rich in context and value for us as medical professionals. And thank you for volunteering in the unknown, phase of this. And, I, like many others, feel like many other healthcare professionals, feel like I've gone back to medical school this last year, because the information has indeed been fast, furious, of various caliber, and connected to people makes it real for all of us, and connects it to our mission. So what I would say, there is a certain part of the population that's hesitant. There's also a certain part of the population that is, rabidly seeking to be vaccinated. And so I would say that I deal mostly with the rapidly seeking, because of the vaccine amount and shortage. If we could fast forward here for 60 or 90 days and let everyone know that, they're going to, by that time, we'll probably have multiple different vaccines approved. The market, for in all intents and purposes, may be actually flooded. You might actually get to have a choice of which vaccine platform you might want to take. And then also, understand, we'll begin to understand more about this. As you guys have noted, you guys had your vaccinations in the fall. People ask, well, what's the long-term, immunity from these vaccines? And I'm like, well, we probably got 8 months of data, maybe at the most, right? We can't answer that question. So we've been humbled by this virus many, many times and saying, I don't know. And we continue to do that. The vaccine rollout, as you know, in LA County, we've vaccinated, thankfully, to the LA County Department of Public Health and our public health professionals. Like Dr. Simon on tonight, we've vaccinated a quarter of the vaccines have been delivered in LA County that have been delivered in the entire state. And so, we're in the state. One of the things that you're probably hearing about is, this third-party administrator, Blue Shield, coming in to try to help facilitate things. The issue is that we have a couple of million doses that are not accounted for. Either they've been delivered and they haven't been entered, or they're sitting in people's, freezers. And so this is creating a way that we need to get it right, because this is just the starting gate. And so we do need to have a system that's going to work for everybody. I would say for me, where we're vaccinating has been the happiest place in the hospital ever since we started doing it, right? There's a sense of, to quote Austin's, comments, there's a sense of hope and light at the end of the tunnel. And I can just say I appreciate all of you that participated in the trials for being a part of that light, because I think, you know, each of us, when we come together and provide what we can, I think it makes us all better and all our communities better.
And Dr. Riggs, how do we know the vaccine can be trusted?
So, you know, I do have some slides if you would like for me to look at them. We could pull them up real quick. It's a little bit about the mRNA platform, but also about the numerous mRNA, which are the Pfizer and the Mrna vaccines that first came on the market. So why don't we just walk through these real quick? I promise I will not do death by PowerPoint. If you can advance to the next slide. This is just how mRNA vaccines work. This is looking at the one platform. So this is an infographic if you advance. So this just talks about, this is the scientists sequenced the genetic material of the SARS-CoV-2 virus that causes the COVID-19, and they revealed the blueprint of the virus. They were able to make the critical spike protein of the coronavirus by reading the virus mRNA. So the vaccine gives mRNA an instruction manual to create just the spike protein. And in the next piece, the cells then read the instruction manual and start making the spike protein, right? And so what that does, it allows target practice for the immune system for the bodies to build antibodies that can fight the real virus. So this was the first platform that came out, and the ones that are released that we're currently vaccinating in LA County. If you advance one more, you can see that there's a summary here, one more, that currently we suspect that there's 2 shots for the full immunity, but it is a safe and powerful way to stop the spread of COVID-19. And evidence show that when they're vaccinated against a disease, they protect themselves as well as others. And then how did it get there so fast? And why? So look, these are the number of trials that have been going on for over 5-7 years, even with this platform of mRNA in the virus arena and disease arena. There are many other ones in the cancer vaccines and therapeutic approach based on mRNA. So it's not new. It's not the first time tested in humans. And why did it happen so quickly? The next slide shows a series of pieces around that. Since we already had the technology, we could insert a new mechanism around this to have it produced. The government and private funders short-circuited the general waterfall process of research and development, testing, and then vaccine production to be after each other, to the research and development happening, and then the vaccine production and testing occurring at the same time, so that when the testing came out, the vaccines were already produced. So by shortening those cycles, no steps were skipped, but they were accelerated by that. And then to the panelists that had the vaccine trials, the clinical trials received a much larger number of volunteers than is typically in the early stages of the vaccine development. Again, part of our response as humans. And in this vaccine, the virus, it is a very simple vaccine, just the mRNA, the lipids, also known as fats, and salt and amines, as well as sugars. I think that the next slides just talk about the expectations about what you get when you get a shot, which I think folks have described pretty well. With some arm, you get some pain and swelling on the next slide. That's what you get on the first shot. And on the second shot, you may actually get some fever, chills, tiredness, and headache. So these are all generally resolved within 24 hours. So I think that those are helpful in trying to understand both the technology of the vaccines that we're currently giving in LA County, but also how they were produced in such quick fashion, but no steps were skipped in the safety protocols. Is that helpful?
Very helpful. I know that was one of the questions was, is this timeline normal? So I think it's incredibly helpful to hear that, this isn't an abnormal timeline, that this is following a typical and trusted process. Dr. Zahn from Cedars-Sinai as well, thank you for being with us. Could you tell us about your experience, and also what is the efficacy of the vaccine, especially as it relates to different variants of COVID?
Sure, happy to, and thanks, Mayor, for having me, and really a big thanks for the volunteers who are on this call who stepped up and met that call. I mean, things like this don't happen without citizens stepping up, and particularly in such a politicized environment. We all know what the past couple of years have been like, so I think you're really to be congratulated and a big part of the solution to this. So full disclosure, just because I have an MD after my name, I am in no way, shape, or form an expert in COVID or any other virology or public health. I have spent the last year, almost exactly a year, working with intensely sick patients in the ICU at Cedars, where we had at points a very, very large volume of really sick COVID patients. I'm actually a pediatrician and pediatric heart specialist during my real job, but like a lot of physicians, we just stepped in where we were needed. What that did do, though, is it gave me, I think, a somewhat unique perspective on how devastating this disease is across the board. Yes, there's a lot of older people who end up in the ICU, and yes, a lot of them have comorbidities, but I saw guys and women much younger than me with no other comorbidities, with tragic stories, and some of whom ended in loss of life. And I've been in medicine about 35 years, and like everybody who's in medicine, none of us have ever seen anything like this, like Rick just explained. So trying to learn on the fly while sort of bullets are flying by because people are getting really sick was something you have to realize that I don't think any, unless they were wartime physicians, none of your physicians or nurses or healthcare providers have really experienced in their lifetime. And I will tell you, in terms of healthcare providers getting the vaccine, I think I probably represent the vast majority of doctors, nurses, therapists, et cetera, all the people that make a hospital and healthcare system run. We could not get this fast enough. And I think that's a combination to what Austin alluded to. We believe in science. That's why we're in this field. And we were just following the science and ignoring the noise and ignoring the politics and seeing how devastating this is, and watching families go through this, and actually just watching my own family and the apprehension they had every day we went to work and came home and had undress in the garage and run down to the shower and all of those things. There's just craziness. So I think as people who have some basis of knowledge about diseases and health and healthcare, I will tell you as a whole, I have yet to meet a healthcare provider, and I work with lots and lots of them, talk to even more all around the world on a daily basis. I don't know anybody who in healthcare who didn't want to get this vaccine as soon as they could. In fact, I think I called Rick on a weekend asking him how soon I could get in because I had a lot of hours coming up. In terms of the efficacy, again, I'm no expert, and I would defer to some of the people on this call, but my understanding from everything I've read is, the two vaccines that are currently approved are so much more effective than what we get every year at Cedars. And I think at most hospitals, we are mandated to get a flu shot every year. We can't come to work unless we have proof that we've gotten the yearly flu shot. And on a good year, I think that's something like 40, 50% effective. So when we hear things like a vaccine being 90 to 95% effective in getting a disease and or mitigating the severity of it, those are unheard of numbers. And I tried to get a handle on side effects now that we have 50-something million people vaccinated. And the last number I saw was that serious side effects are on the order of 0.0018%. That's a really tiny number. And deaths are far, far lower than that. And most that have been reported are not attributable. They go and track each one, the CDC, et cetera, and they can't track these back to the vaccine. So I don't think in my medical career, which spans over 3 decades, we've seen something this effective and this safe in almost any branch of medicine, much less a vaccine. And that's my sentiment on it.
And since it's not your area of expertise, as you've said, exactly. Where do you go and where would you recommend people go to get information about the vaccine? I think, you know, we all hear the talking heads on news shows. We read as ravenously as we possibly can, you know, every bit of information. And I think sometimes we get conflicting information and then our heads are spinning. So where would you recommend people go to get information?
Yeah, you know, I did, and I think Amanda did, and Austin did. I went to people I trust. So that's right. I'm not an expert, but boy, I sure know a couple of infectious disease doctors and a couple of public health people and some people at the NIH and CDC. And I emailed and called and texted, and people I trust. We know there's a lot of hesitation and a lot of mistrust. And I think we heard from the volunteers, you know, some really good reasons why that is. There's historic reasons. There was the current political milieu that we were all living through. Those are good reasons to be skeptical. So I think going to your family doctor, I know probably Teresa has a lot of insight into that, as she has a big patient population that comes to her. You need to go to somebody you trust, and you know that they're giving you the answers that they believe are solid, and there's no motivation, there's no agenda, and they'll be taking care of you after this. So they're obligated to you.
Well, that's a great segue. Dr. Dean actually is my doctor. And so I'm grateful she said yes to being on this panel, because she gets a lot of those questions from me. This was the first year I got the flu vaccine, and at her encouragement. And then I ended up having an allergic reaction the same day I was supposed to run a council meeting, and I called her office freaking out. And so, you know, having that experience, you know, I'm fearful about what, you know, what experience I might have as a reaction to a COVID vaccine. And so, Dr. Dean, if you could talk a little bit about your experience and how you're advising your patients, you know, to help them get over their fears and get to a place where they feel comfortable accepting the vaccine for their own safety and health.
Absolutely. And again, I want to resonate just the big load of gratitude to those panelists on tonight who have participated in the trials. And I think that, you know, events like this, where people get to see real people that they feel like have no possible skin in the game, you know, who are just going through this experience themselves too, is really helpful to our patients. So thank you for even being on here tonight too and hosting this. I see both sides. I do see the vaccine hesitancy and the 8 calls to my office in one day about whether we know any more yet about where they could get a vaccine. We do get to see all sides of it. And I think that a big portion of what we can do in primary care, which was a hard place to sit. We go into medicine so we can help people, so we can fix things, so we can make it better. And we sat in this pandemic with very little answers, very little ways to fix things. And thank you to Dr. Riggs for always being there at Cedars to have more information for us, because there was just no way to take care of the amount of patients we needed to take care of and stay abreast of the barrage of information that we were trying to assimilate. So, you know, I think being honest as just providers with our patients about the experience as providers, about what we do know and what we don't have solid answers on, is important. I think that being really clear about understanding people's space they're coming from with vaccine hesitancy too. Some people, their vaccine hesitancy might be they feared a shot when they were 4, and that's a completely different experience than someone who has an experience of major mistrust in their family or their community due to things that happened on a larger scale. And it's important to listen to your patient's experiences so that you understand where someone's coming from, so that you can speak into that at all. You know, we can't come with the same answer for every person, because people's perspectives are going to be variable based on their experiences, their family's experiences, their community experience. And so the most important thing that we do is listen. And after that, we can share the information that is then relevant to that experience. So I think that's been a big part of our job, as it always should be. But I think it's been even more poignant and important in this pandemic, because not only is someone's vaccine perspective important, but how COVID is impacting them and where they're coming from in this. So whether it's been loved ones that have been ill or passed, whether it's been economically a huge struggle for their family. So people come in with a lot of emotion tied around this pandemic, and giving that time and space to be able to hear what that has been for them and what we can do. Because at the bottom line is, we know that vaccine is our only way out of this. And yes, there is a lot that has gone into something we have all witnessed. No one's ever paid this much attention to healthcare on a daily basis, you know, and to what's happening in science to pick it apart. So I also go back to people and say, you know what, when we talk about doing our research, you know, a lot of times that means for people looking at the news. And while the news is important, we also need to take a step back to where they're getting their information from to feel more comfortable with it. So I tell my patients right away, like, if you're Googling something, put research at the end of it, and then look up the first few things says scholarly articles, and it will tell you right there, the things that say NIH.gov, that's the one you want to click on, because that's the thing where you're getting the base information of the research. No one's kind of pre-digested it and given you a few sound bites. You can look at the study. And then when you have questions, you can message me.
And so I know many people in West Hollywood go to Cedars-Sinai, and people in the area go there. So any idea when Cedars might have those vaccines available for the broader population? I know that's a lot of the question in the Q&A that we got.
Yeah, I'm sure. And I would defer to Dr. Riggs on that one, but I know that it's probably even a bigger question than that. We are all anxiously awaiting being able to distribute that in a faster and wider scale, but it is still coming.
Right, and we may let Dr. Simon actually address that if he knows more, but I was typing in the chat that, probably in the next 4 to 6 weeks, we're going to see some significant movement. And we're geared up to do up to 30,000 in the second floor of the Bentley Center, drive through a week. So we have significant capacity if we can have doses. So that's some of what the third-party administrator is working through at this particular point. And so we're all on the same page, like, bring it on, we'll get it in the arms, all right?
And so how long is, Dr. Riggs, how long is the vaccine, how long does it last? Do we need to get booster shots, do you think? Does it address all these variants we're hearing about from South Africa or Brazil or the UK?
So thank you. We don't, like I said, the vaccines have been around for maybe 8 months maximum. So that's our track record of how long they may produce immunity. As those, the groups go out, thank you for logging in every 2 weeks and doing your symptoms, because that's going to give us the long-term data we need for, to understand about immunity. With regard to the variants, there's variability coming out. We'll know more about those and the penetrance. What happens in real life is different than what happens with the antibodies that you make right afterwards. And so that's what they're coming out with, tests about the antibodies, but we have longer term B and T cell memory for, so that produces immunity. So we actually don't know. And then with the boosters, we're, not quite sure what that may look like, but we'll have more information with regards to that and whether they're actually needed. But, it might be that that's something that would become a norm in the future if enough variants emerge. And I'd love to hear Dr. Simon, his perspective on that, because I think that's still an area that's just emerging as a question that we may be able to answer.
Well, what do you say, Dr. Simon? I think you're still on mute. There you go.
Thank you. Thank you. I've really appreciated the discussion so far. And I want to thank you, Mayor Horvath, for the invitation, and so appreciate actually being on a panel with so many different perspectives. It's really very helpful. I also want to express my gratitude to the community members that participated in the trials. It takes a lot of courage because you're not always so sure, what the outcomes are going to be. So thank you so much. I don't often get a chance to say, but I want to thank the frontline healthcare workers, the incredible courage that you all have demonstrated over the past year. It's just been amazing. And I know we almost brought the healthcare system to its knees in December and January, our biggest fear actually. And fortunately, we were able to reverse that surge just barely in time. And now we're on the downward slide and it's looking very positive. We do need to continue, I think, to be cautious, particularly given the potential emergence of the variants. I will say, as painful as this past year has been, I know for everybody out in the community and for us in public health, it's really been in the last 2 or 3 weeks that I've begun to feel some optimism. We're getting reports, for example, from Israel, where the vaccination levels are very high, over 50% of the population vaccinated, and there now is some evidence that vaccines not only prevent illness, but actually appear to prevent infection, even asymptomatic infection as well. We'll need more data to confirm that, but that's a very positive sign. And even some sense that maybe this very rapid reversal of the surge could reflect the early effects of the vaccination efforts, although there may be some other factors that explain it as well. So I just want to spend a couple minutes talking about our vaccination efforts. We've been at it now for about 9 weeks, and we've vaccinated about 1.7 million persons across the county, at least the initial dose, and we now have about 500,000 people who are fully vaccinated, so that's very good news. The rollout still is not happening as rapidly as we would like. We're getting about 200,000 to 250,000 doses of vaccine each week. And I should mention that the vaccine flows from the federal level down to the state and then down to us. We have close to 400 vaccine providers across the county. We have by far the most robust network of providers as anywhere in the state. And I would hazard to guess anywhere in the nation, with perhaps the exception of New York City. As we've surveyed all those providers, what we found is that we have the capacity right now to vaccinate about 600,000 people per week. So again, we're only getting about 200 to 250,000. Right now, we could be up at 600,000, and we're just waiting for that supply to increase. We are cautiously optimistic, as I think Dr. Riggs may have mentioned, that we may be getting an increased supply over the coming weeks. The Janssen vaccine is up for review, I think, just within the week, and could be available to us in March. Plus, the federal government has purchased more, more supply of Pfizer and Mrna, and so that I'm hoping will translate into much more vaccine being available in the county. I know there's a great deal of frustration, many people who desperately want the vaccine that have not been able to get it. As many of you know, there are the vaccination efforts are being rolled out in phases, and the so-called phase 1A, where frontline healthcare workers and residents and staff at long-term care facilities, skilled nursing facilities, and other long-term care facilities. And then we moved into phase 1B and prioritized first the seniors 65 and older. We're moving pretty quickly through that group, not again as quickly as I would like, but at least we're now up to about 40% of that population having received at least one dose. Unfortunately, we see a lot of disparity, though, across the county. As we, for the first time last week, we're able to look at the data by city and community. And we see in some communities vaccination coverage rates in the 65 and older that are well above 50%. And then in other communities, it's down at 5 or 10%. So we need to do a much better job of more evenly distributing the vaccine across the population. And then you may have heard, beginning March 1st, we'll be expanding eligibility to include some worker groups, people working in education, so teachers and staff, and also childcare providers, workers in the food and agriculture industries, and then emergency responders. So that's about another 1.4 million persons. Seniors 65 and older in the county are 1.3 million persons. Frontline healthcare workers are about 600,000. So with these new groups being added, we're up at between 3 and 3.5 million people in the county being eligible out of a total population of 10 million. Given the supply of vaccine, though, right now, it's going to be a somewhat slow process. But I think with what has been projected in vaccine supply over the next 2 to 3 months, I'm again cautiously optimistic. I don't want to make any firm promises, but cautiously optimistic that by April, we'll be able to vaccinate many, many more people, and many more people will be eligible. I think I want to close by saying that I would urge, it is, as someone said, a very kind of fluid situation. So in the presentations I give, where I provide statistics, for example, or describe where we're at with the rollout, I find sometimes a week later, the landscape has changed quite a bit. So I really urge everybody who wants information to use our website, vaccinatelacounty.com. We've worked very hard to have a lot of information about the vaccine, hopefully answering a lot of people's questions. It's also a site where you can register to be vaccinated. I do agree with Dr. Dean, though. It's important to look for other credible sources of information. NIH, absolutely. The CDC, while the CDC, the Centers for Disease Control and Prevention, did receive a fair amount of criticism, and I think, unfortunately, was unduly influenced by the politics. I didn't see any false information coming out of the CDC. What I saw was a suppression of information, but the information that they did share and their guidelines, I think, were supported by the science. And I think with the new administration in place, I have every confidence that the recommendations and guidelines that they'll be disseminating will be evidence-based, science-based. So I'll close there. I'm actually looking forward to all the questions. Thank you.
Thank you, Dr. Simon. I know our city manager invited you to participate in a contract cities discussion with city managers, and I thought the information you shared was incredibly helpful, and so thank you for the information that you're sharing. And of course, you are from the LA County Department of Public Health. We've heard recently about changes in the process for administering the vaccine. What role did LA County play as opposed to the state or the federal government in coming up with this process? And what should people expect of this process going forward?
Great question. So to date, we've not controlled the amount of vaccine we receive. The state tells us how much vaccine we're going to receive, but then we had quite a bit of authority to determine how that vaccine got distributed out to various providers across the county. And the state is pivoting, though, to a more centralized approach with, as has been mentioned, a third-party administrator, Blue Shield, that will be sort of orchestrating the process, and a statewide network of vaccine providers. We're going to be meeting with Blue Shield later this week to learn a little bit more about what they plan. And we're going to be advocating very, very strongly to preserve our network of providers. We've, I think, worked very hard to make sure that we have good coverage across the county. But it appears we will not have as much control. I have to say, at the local level, we will be one of many vaccine providers, and we will certainly be able to recommend to the state how we think the vaccine should be distributed across our county. But ultimately, they'll be making the decisions. They're urging all providers to use their registration system for people who want to make appointments. It's called My Turn. It's a much improved system than some of the earlier versions. We would prefer that there be more flexibility. We know there are large healthcare systems, and then even some of the smaller community clinics that have their own registration systems that they're used to using, and we think that would be a better way to go, as long as our local providers that can then upload the data to the state's data system. The latest I've heard is that this Blue Shield may back off a little bit and allow at least some of our bigger systems to continue to use their own registration systems. So there may be some changes, but I'm hopeful particularly with the increasing supplies of vaccine, that we'll be able to continue our efficiency and hopefully effectiveness in getting the vaccine out into arms very quickly.
So as of today, the best place for people to go to sign up to get the vaccine, I assume, is online, or is it a telephone number? What is the best way for people to sign up right now?
Yeah, vaccinatelacounty.com would be one of two good ways to register online. The other would be to go directly to the state's My Turn site. I think the advantage of our site is you can see a little bit more clearly who our providers are and where they are. We do have a call line option, and I don't have the number off the top of my head, but it is available on that vaccinatelacounty.com website. And that was particularly important. We know there are many people that aren't all that comfortable with the internet, especially seniors. And unfortunately, that call line was overwhelmed the first week or two, but I've heard it's quieted down a bit. We're also going to be working more directly and I think deeply in communities. We have a whole cadre of community health workers that are going to be providing more hands-on support for folks that are having difficulty scheduling an appointment. And we're working with our community clinic partners also to support their patients in helping them navigate the appointment system.
Lindsay, I do want to follow up with Dr. Simon. The contracts and changes are happening hourly almost with some of the things we're hearing about, but it does look like everyone will be going through the My Turn as a front door. They may be able to select a local area, a local hospital or provider near them, but looks like everybody's going to be going through that front door, which will indeed provide some, I'll say, solidarity and reliability to everybody be knowing where to go, because it's been really very variable across multiple different counties. And I think LA County they have a wealth of resources, by the way. And so, the prioritization and allocation, the eligible vaccine sign up, the scheduling, there's COVID-19 resources there. So they've really invested heavily. So thank you, Dr. Simon, for helping promote that.
I just want to follow up. You make a really good point. One of the reasons the state did want to go to a more centralized approach is that there was so much inconsistency across counties, and they weren't getting the data that they needed to be able to track what's happening across the state. So I think that may be one benefit of a more centralized approach.
So I know along the way, some questions have popped up into the Q&A function on Zoom. So for those who are able to access that, questions have been answered there. So please feel free to check in there and see what questions have been answered already. You're welcome to put some questions in there as well to start to get into some of the questions that have come in from members of the public who are very excited about this panel. One question was, are there post-vaccine studies for patients who have specific medical or genetic histories or are pregnant, breastfeeding during vaccination for further follow-up? If so, are there links that you can provide to colleagues or patients to sign up?
Yeah, I don't know who wants to, I can start. Fortunately, the vaccine trials did include a diverse study population, both with a number of folks with various chronic health conditions. They did not include, though, women who were pregnant, although some women did become pregnant during the trial. But we do have the benefit now of 45, 50 million people who've been vaccinated. And there are definitely follow-up studies happening. I don't, off the top of my head, though, have information on how folks could sign up for those studies, but I can look into that. And Mayor Horvath, I'm happy to forward that information to you in the next day or two.
Thank you very much. We also have a question whether a booster vaccine will be required this fall to protect against variants. We kind of talked about that a little bit earlier, but do we anticipate that it would be possible for additional virus mutations to render the current vaccines ineffective? That's another question that came in.
Well, as I said before, anything is possible with this virus. I think we've learned that. And so I think that we'll have to wait and see, but just know that there are legions of folks that are doing testing and looking at each of the variants as they emerge to understand what their potential spread may be, but also how that may impact, sort of their impact on any individual who gets them. I do want to point out, though, that we've sort of mentioned it here. There's, someone that is not exposed to the virus, then you have someone that's exposed to the virus, and you could have an amount of illness there that's variable, right? What we're trying to do with the vaccines is prevent that from going to anything further than that, where there's actually the body reacts and you have to have hospitalization and you send things off. So anything that can prevent the later, pieces of that is what we're trying to prevent for saving lives actually on a global scale. Because it's really, if people are able to still get infected mildly and become carriers, that's why we're all going to wear masks even if we're vaccinated. But if we're preventing severe disease and hospitalization, this is the real win for everybody.
For the previous question regarding the call-in information as opposed to accessing online, because we know some people won't be able to find the telephone number online because they couldn't get online in the first place.
Yes.
Residents with disabilities or without computer access can call 833-540-0473, and you can call between 8 a.m. and 8:30 p.m. 7 days a week for assistance with appointments. And I know this question came up on one of the conversations that local government officials had with Dr. Ferrer. You're gonna get in the same queue if you call or if you go online. So don't go online to make an appointment and then also call, because you're just gonna double book yourself and risk cancellation. So choose one or the other. And if you're able to do so online, use that. So that way people who can't go online can use that phone service. This is for, I think most of you know that you've received a vaccine, whether in a trial or because you're healthcare professionals. This question is about vaccine side effects. A friend had intense back pain after the second shot. What medications do you recommend to be used, if any, for side effects that people experience? Although there have been cases of people getting vaccinated who experience side effects, how truly safe are the current vaccines and what should I be prepared for?
I feel like I answer a lot of these questions, so I might jump in on that one. I think first and foremost, we kind of differentiate what we typically look at as side effects and adverse effects versus an immune response to the vaccine. So a lot of times a lot of importance goes into talking about what it means to have a response to a vaccine. We're trying to teach our body to activate some things in our bone marrow, produce some cells in our body that are going to protect us. So there are some responses that our body mimics as it would when we see a virus in the first time, except for luckily we're not actually seeing any portion of virus in this case. So I think part of it is the reassurance that this is part of the process for many people for activating our immune system. And then as long as it's safe for you, which is important that you have that conversation with your physician, we could use Tylenol and or ibuprofen, but it's really important that you know your own medical history when you choose one or the other of those medications, or to alternate those, because there are, for some people, reasons that they shouldn't take, Tylenol or acetaminophen, or that they shouldn't take an ibuprofen Advil kind of class, particularly looking at like liver or kidney processing. But for a lot of our healthcare workers, I know, because we were working through all of this and trying to get through the next day if we felt a little achy or tired. I'm a medication minimalist. I take the least amount of anything I can possibly put in my body, and I've had my vaccine. And I did post-medicate and took Tylenol after my vaccine on the second one, just in case, because I knew I needed to be busy for the day. So those things do help reduce kind of that inflammatory cascade without impacting our actual ability to produce the antibody.
So this question is about herd immunity. Experts are telling us that herd immunity will be obtained once a 75 to 80% vaccination rate is attained. So what is your best estimate of when we in LA County will achieve herd immunity?
What a great question.
Crystal ball it for us, Dr. Simon.
But yeah, I hesitate to do that. First of all, I don't think anybody knows what that level of, immunity is that will create herd immunity with this virus. And some have been concerned that if a more transmissible strain becomes predominant, that the level of coverage may need to be even higher. It could be 85, 90%. We also know that there are many persons, in fact, probably 30 to 40% of our population that has actually had the infection, so has some natural immunity as well. And in addition, at this point, we're not talking about vaccinating children yet. So they're about 20% of our population. So I don't think it's really clear, but I think we will have a good sense of it when we see our COVID case numbers coming down dramatically. And in particular, seeing hospitalizations come down dramatically. I mean, if the vaccine has been widely distributed and it's working, the studies would suggest that it would be very rare that someone would get really sick with COVID. So I think that will be the telling sign. I'm hopeful, frankly, that by this summer we will see that. Now, if children are not being vaccinated, the virus will still be circulating. But our hope is that if nearly all adults are vaccinated, again, it'll be very rare that anybody gets super sick with the infection.
I personally worry that as a society that we're putting too much faith in herd immunity as people are waiting around on herd immunity as opposed to getting vaccinated. So that is something that makes me a little nervous, that we're like this herd immunity is our cure-all instead of, but we need a certain number of people to get vaccinated to even reach that. And so I worry that people are relying on the herd immunity as opposed to getting vaccinated.
It's an excellent point. Another question that has come in, many of us in the African-American community are hesitant to take the vaccine in fear of becoming test subjects for the vaccine that is still experimental. How do we know there are no long-term side effects damaging genetic and autoimmune systems?
Well, I can take a stab at that. The vaccine, as Dr. Zahn quoted, has been given to millions of people at this particular point with a very, very low rate of significant adverse events and reactions. And like I said, this vaccine has been around for 8-10 months maximum being tested. And the other what we know about vaccines in their formulation from the other vaccines that we have gotten as children is that we don't see long-term effects in those vaccines, and so I don't think that we would expect to see them here. We can't absolutely answer that question 100%, but it's not. There may be trials that are ongoing for other vaccines. There's 68 in the works vaccine trials, but the ones that are being offered through the county and city sites are all approved already and they are not in a testing phase, even though they were released under emergency use authorization. But that's a class of, taking a drug through regular FDA approval takes significantly longer. And so I think that that's where we're stuck between this, it's not experimental, it's been proven, but we don't have years and years of data to prove that. And so I think it's challenging. I don't know, Teresa, if you have any advice with regard to how you counsel folks, but.
Yeah, absolutely.
Could I jump in as a layperson too?
Carrie-Ann.
Because this is a question that I had as a layperson, sort of what we don't know what the long-term effects are going to be of this drug, of the vaccines. But I definitely had to weigh against that. what could happen if I or someone that, I come in contact with contracted COVID. And like a lot of other people, I'm fortunate that I'm a healthy person, and I don't have any, comorbidities, knock on wood. But I do, my family does, my parents, I haven't seen my parents in a year. My mother has, has diabetes and has, has a long-term, disability that she, is living with. And so I have not wanted to see her at all, out of risking potentially exposing her. And, what could happen if she got it? I mean, so it's a weighing, and there was a bit of a leap of faith that goes into it. But this goes back to also having trusted, incredible people to talk to, and to seek advice in making the decision, sort of weighing out what are the pros and cons and which would you rather do. And I really want to see my parents and I want to visit, with my family. And I think it would be worse if one of us got COVID and, and became really sick. And, or even if we didn't get really sick, what is it going to be like to just live with COVID? So it's a weighing, it was a leap of faith. And the way that I came to make a decision was by, talking to people that I trust about it.
Yeah, and that's amazing. Thank you for sharing, Kyria, and for being a participant in this and a voice in this. I think that, again, going back to the listening, we really need to listen in our communities, and we need to listen to our patients in order to understand where people's, hesitancy is coming from. But, the leap of faith that Carrie-Ann took was actually to lay groundwork so that other people didn't have to make the same leap of faith in that way. And so, the vaccine trials actually did an amazing job of including participants that were the higher risk groups we were seeing in the COVID infection. So a lot of Black and Brown community, people with the high risk morbidities, in order to see really how this was resulting in the communities where this was causing severe disease with morbidity and mortality. So the research aspect was done, and it was done well. I read the whole paper because I get nervous about anything that goes in my body, and my hubby and I are, we're both working in healthcare, and he was in the hospital, he was going to get it first, and I am like, let me finish reading this paper before you get that in your arm. So I am a full advocate of get the knowledge, because that's what empowers us. And I don't ever want anyone to feel like their concerns are brushed over, but I want them to have the knowledge. And the people here who have participated in the trials have allowed us to have that knowledge, so we should use what we've been given now, which is an amazing gift that these trials have given us, to have this knowledge so that we can move forward and see our loved ones and not have the things happen that we've lost. We've lost a lot of people to COVID, and this is what this is here for, is to help us.
So something else that will be important to our community is the question around whether HIV is likely to be included in the medical conditions that allow people to get the vaccine starting March 15th. That's a question that came in as well.
So I've seen the list that the state has put forth, and HIV was not on that list, if I remember correctly. The only exception may be if it's someone with pretty advanced HIV disease and really low CD4 counts. But to be honest, I don't remember that on the list. It was, some of the other risk factors that CDC had highlighted.
Is there a way to prioritize people living with HIV?
Yeah, I think healthcare providers will have some discretion, particularly if the vaccine supply becomes, more abundant. Yeah, I think physicians will have some discretion. In fact, I'm already hearing stories. I didn't see, for example, multiple sclerosis on the list, but I've talked to an acquaintance who said her sister has multiple sclerosis and got the vaccine. So, I think, these are guidelines. We hope that there's pretty good adherence to them, but we recognize every patient is different. And, we have to sometimes tailor our responses accordingly.
So be a strong advocate for yourselves. Don't take no for an answer. You might still get the no, but keep asking anyway. It sounds like there might be some flexibility. Along the lines of availability of unused vaccines, a question came in whether it's ethical or advised to search for unused vaccines. I know a lot of us have heard about vaccines going to waste. Obviously, we don't want to get in the way of healthcare providers, but we also just don't want to hear them being wasted. And if there are people who are eager to get the vaccine, which we know there are so many, how do we make sure that we're not wasting any of those vaccines once they're open and available? So any thoughts about people who are kind of looking for those unused vaccine opportunities?
Well, I can speak for
I know
we've vaccinated, over 30,000 folks, and we have not wasted any vials or doses. We titrated up to the end of the clinic day, and of course we have the advantage of taking names when people come onto campus. If they're not vaccinated and we have any extra doses, we just call up to the floor and they come right down. So we've set up systems. I think in the smaller sites, especially, some of the vials can be, pretty, large amounts. So it's a little harder, but I don't think it's unethical to wait around for unused doses. But I also don't know that the folks who have been doing this on a regular basis are really going to have that many doses available.
Well, another question came in along related to that topic. So far, it seems that most of this information has been spread by word of mouth rather than anything formally posted or made public. Is there a centralized place for people to get information about to expire vaccine doses so they can go and get them, as opposed to kind of hoping that they heard from their friend with enough time to go and get, show up at the right place?
Yeah, I would say that's what we don't want to have happen. We've worked really hard with our various, vaccine providers across the county to make sure that they are managing their vaccine supply over the course of each day so that there isn't a lot left over. And I think very early in the rollout, there were more instances where there was extra vaccine vials that had already been opened but not completely used that needed to be used quickly. But that's, I think, become less and less common. So our hope is that again, most people are getting the vaccine through, the routine channels, and that, everybody has a fair opportunity to be vaccinated if they're in one of those eligibility groups. And we really do encourage people that aren't eligible yet to try to be patient. We'll get to you, we'll get to you as soon as possible.
I heard that the state also created a code specific for communities of color or disadvantaged communities to be prioritized to access, and then that code got circulated in other communities and got dispersed to people it wasn't intended for. Do you have anything to say about that in reference to that? Should we be sharing this code information? What should we do with that? And
so if you're
responsible.
Yeah, if you're in a group that's received an individual who's part of a group that's receiving a code, we would urge you not to share it. But we recognize this has been a big problem. We're working on what we call a single-use code. So an individual could be contacted with a code that no one else gets, and that would allow them to schedule an appointment. And again, we're prioritizing here people that live in communities where the vaccination coverage rate is really, really low.
There's another question in here about the Israeli study that shows a single dose is 85% effective. Why would we not? Why would our approach not be to focus on the first doses and spreading those around rather than holding them back to ensure timely second doses? So can you speak to that strategy a little bit?
I'm not sure if anybody wants to. I'm happy to jump in. That's been a very lively debate actually around the world and even in this country, some have argued that we really should be focusing more on maximizing first doses, but others have argued that, you know, while there seems to be a pretty robust response with a single dose, we don't know how long that will last, and the second dose does give a very clear boost. And since the vaccine trials included those 2 doses, we should adhere to that. So at this point, I think I've not seen any movement to a more expanded first dose. And as vaccine supplies increase, hopefully there'll be less and less pressure to have to deviate from the protocols that were defined in the vaccine trials.
I do have this conversation with patients as well, just because I even get some of the question like, well, you know, I heard some people, it feels bad to get my second one. Could I just get my first? And so, you know, the conversation I have is back to, we want to be supported by the science, and we really don't have, these are kind of estimates that are being made to say, well, it might have this much efficacy after the first one, but seeing as how that wasn't how the study was done, and we then didn't carry through to find out how that happened later on down the line, we don't know. And if we do focus on just first vaccine, we miss the opportunity, because it's not like you could just come back 6 months later and give the second one. What we know to be effective is this window of time. So I think we have to really try to trust in the science and take the time to get it done right.
So those who participated in vaccine trials shared who they participated with. There was a question in here about if you've been vaccinated. I believe all of our medical experts have been vaccinated. If you are able to share with which manufacturer you were vaccinated.
I received Pfizer. I didn't have a choice. I was very happy to receive either one. As I think several of the physicians mentioned, you know, or maybe Dr. Zahn mentioned, I was so excited to have the opportunity. I didn't expect to have the opportunity, but then I began working at some of our pods, and so, you know, was then eligible.
And Cedars has been only given the Pfizer vaccine for distribution, partly because we could handle it with the cold storage requirements and the large amounts of people that employees and people who are delivering healthcare. The only Mrna that we have gotten has been for the local fire department and the first responders, because they had a much smaller window to use the vaccine.
Well, I think this last question is the perfect one to end on, and each of you have your own relationship to what the vaccination process has been for you. This person shares that their in-laws are 78 and 83 respectively in a high-risk group, and they've been reluctant to be vaccinated due to misinformation from the internet and family members who we believe have been radicalized. I've been there, I know that. What can we do to convince them to protect themselves and get vaccinated? What is your best advice, and what is your greatest encouragement for people to get vaccinated? Let's close it out with that one. Anyone can jump in.
Can I say go ahead, Austin. Oh. I was just gonna say, as a layperson, you know, I did not expect to experience the sense of relief that I did when I got unblinded and found out that I was vaccinated. I mean, I was pretty neutral about whether or not I got it, because I knew I was going to keep masking and kind of, you know, lead the same kind of life. But I really have been very relieved that I've already done it. And, you know, just that. And my husband, fortunately, he was able to get vaccinated as well. And so through his work. And so, you know, I'm really glad that we don't have to go around just in, you know, fear of contracting it at this point, and of what could happen to us if we contracted it, you know. So, I mean, the relief is really, it's very real for me. So I would share that.
I think Carrie Ann put it really well earlier when she was talking about, you know, it's a matter of weighing things. And at that age, late 70s, early 80s, mid 80s, I wish there was a way for people to see what getting this and getting really ill from this looks like. It can be a terrible, terrible disease. and the side effects, which are minimal, you know, a little tiredness, a little headache, a pain in your arm for a few days, is so trivial compared to what we're seeing folks go through, especially in those higher age groups. You know, that's universal at Cedars and everywhere else, that I think they really need to weigh that, and that the virus is still very much in our community, and you don't want it. And this is a chance to really immunize yourself from that. And I think it's weighing it that way.
You know, one of the things that helped me when I was having some of these conversations with my more reluctant loved ones was recognizing that nobody refuses a vaccine because they think that it's going to harm them or their community. They do it because they honestly think that it's the best choice for them and their family and their situation. So for me to kind of take a step back and to take it from a really ground level approach and say, like, I want what's best for your health. I know you want what's best for your health. Let's have this conversation and really work through it, because there's so many really tightly held and fearful beliefs that people are holding on to that are curbing these decisions. When I've been able to have an honest conversation, let them know that I'm on your side. We are in this together. I've done this as well. I understand what this fear is about. This is how we have to move forward, though. Or maybe less forceful language than that, but working with them to get to that point has been really helpful. And I just wanted to close my last thing. Carrie Ann said she hasn't seen her parents in such a long time. I haven't seen my dad in 14 months. And he just texted me on this panel that he just got his vaccine. Like just now. I'm really happy.
My parents got theirs today. So we're planning our visit for next month when they get their second shot.
I think that for me personally, when I did this trial in October, I was so excited, and I tried to get every single person that I knew involved, and no one would do it with me. And then I finally got one friend into Johnson & Johnson in November, and nobody would do it with me. And then all of a sudden, I guess after, you know, watching me work with the public and seeing that I didn't contract COVID, a lot of my friends jumped on, and now they're all in the Novavax trial because it's going to be a while till they get their vaccines. My mom has also been vaccinated. She's back in the Midwest, and my grandfather, who's in his 90s, he's also been vaccinated. And so for me, I think the best way to combat misinformation is talking to people or seeing people that you know in your age group that you trust. And so I think that if there's a way to make that happen, or a story to share, then that's probably the best way to reach people.
I would say for me, probably the most effective conversation is the one where I share my own hesitancy before I could read the research. You know, when it was just, well, it's coming, and everyone would ask me, what do you think? I would be honest. I would say, until I can read the research, I can't tell you what I think about it. I think a vaccine is the answer. Whether this vaccine is the answer, I need to read first, because it's going to my body too. I would love if we were in an ideal world where none of us needed a vaccine. I'm not excited about a vaccine like I am ice cream, but like I'm excited for us to have an answer that works. And once I was able to read the research and really go through, you know, the history of mRNA to understand the functionality and be able to share that journey for myself, and then share the information that I digested from that research, I think that helps a lot of my patients who have gone through wondering, like, are the sound bites I hear on the news enough for me to make this decision? And I think it's important that if you have family members and loved ones who are still hesitant, that hopefully you find them a healthcare relationship that works for them, where they feel like they get very transparent communication, so they can feel like they're making decisions that are really well backed in for them.
Dr. Riggs or Dr. Simon, anything you'd like to add before we close?
I think all really good advice. I think what doesn't work is telling somebody to do something. I think I share what I know, and if it's someone I have a relationship with, I can then explore a little bit more deeply. But I think the advice that others here have shared is really good.
Very rich. I would agree with that. And it's great to close with encouraging from the heart, as well as where people are. So thank you for the invitation tonight.
Yes, thank you for all saying yes. If you can believe it, there were other people who actually volunteered and said they wanted to be on the panel. I said, we're quite full, Happy to host another panel to continue the conversation if you like. But to everyone who volunteered their time here tonight and everyone who volunteered their time but wasn't able to join the panel, thank you very much for the work that you're doing to keep people informed. I think this was incredibly helpful. I tried to keep my chill throughout, but you all are, I mean, this is such an esteemed panel. Your expertise, your experience, and your bravery signing up for these trials. I can't thank you all enough for what you've shared here tonight, answering questions and just being available to our community. I think this is what we need to do in the community to help people get educated and be put at ease as we move into this next stage dealing with COVID-19. Thank you for putting yourselves on the front lines and for everything that you're doing each and every day. We're very, very grateful to you and indebted to you for the work that you're doing and continuing to do. So with that, thank you to our staff who made tonight's event possible. Andy, shout out to you for all of your hard work. And this recording will be available online, so you're welcome to share it with anyone who you think can benefit from this information. Thank you all for being with us tonight, and enjoy the rest of your evening.
Great. Thank you.
Thank you. Bye-bye.
Thank you. Thanks, Mayor Horvath.